Thank you for considering MedStar Health Home Care as a partner to provide home care services for your patients. In this short video, we aim to explain the benefits of ordering home health care services, what makes a patient a good candidate, and how to complete and submit a home health care order. First, let's talk about home health care and how it helps patients. Sometimes when patients are discharged from a hospital, nursing home, or rehabilitation center, they still need extra help and monitoring by medical professionals. You may also have patients who are disabled, struggling to heal, or living with chronic conditions like COPD, diabetes, or heart failure. Eligible providers can initiate orders for these patients to receive in-home healthcare services provided by licensed clinical professionals. For example, you may have a patient newly diagnosed with diabetes who could benefit from skilled nursing care at home. They may have a wound that will not heal, or maybe they cannot keep their blood glucose levels under control. Nurses help patients with diet and lifestyle changes, medication compliance, insulin administration, and wound care. Our nurses can help patients identify and control negative symptoms so that we can help prevent emergency hospitalization. Registered nurses can also help patients who need home infusion therapy for nutrition, antibiotics, chemotherapy, milrinone, or other IV medications. When you order nursing for your patients, they may also qualify for assistance from a home health aide. Aides help patients with personal care needs like bathing or grooming. Another service that may benefit your patients is in-home rehabilitation. MedStar Health Home Care offers physical and occupational therapies. Our PTs and OTs build personal home exercise plans to help patients build strength, identify necessary home modifications, increase range of motion, and prevent falling. They help patients figure out how to regain independence with daily tasks in the home. The rehab team also includes speech and language pathologists. They can help patients recovering from stroke, cancer removal surgery, or other injuries. Speech therapists address difficulties with swallowing, speaking, and cognitive function. MedStar Health Home Care offers medical social workers who will assess a patient's ability to live safely and securely in their current environment. They can refer patients or their caregivers to community resources like Meals on Wheels or adult daycare and other support as needed. Now, let's review home care eligibility guidelines to help you determine whether this is the right level of care for your patient. First, home health care must be initiated by a doctor, nurse practitioner, or physician's assistant, and the provider must be willing to oversee the patient's ongoing home care treatment. This includes signing future orders if the patient's home care treatment needs to change. Patients must have a face-to-face encounter with the provider within 90 days before the home care order or 30 days after. Home care is specifically for patients who have a difficult time leaving home. This means they need assistance from a person or an assistive device. It's important to know that home care is not long-term. In-home services normally last 4 to 8 weeks. Lastly, home care is part-time and intermittent. Patients typically receive care just a few times a week. Each visit lasts about 30 to 45 minutes. Now that we have covered the benefits of home care and eligibility, let's review the steps necessary to submit a referral or an order to initiate home care services for your patient. According to regulatory guidelines, orders to begin home care services must be signed by a physician, nurse practitioner, or physician's assistant. Please note that residents, registered nurses, and medical assistants can write orders, but they are not eligible to sign home care orders. In addition, the provider who signs the home care order must be certified in the Provider Enrollment Chain and Ownership System, also known as PCOS or PECOS. For more information about PCOS, please visit their website. To refer one of your patients for home health care services, visit the MedStar Health Home Care Refer a Patient webpage. On our website, you will see that we partner with several online referral submission platforms. If your organization does not partner with any of these platforms, you can submit a home health care order through fax. The website has a home care order template that you can print or download for use. At MedStar Health Home Care, our goal is to help patients heal, regain the ability to live life independently, and to prevent medical emergencies and stays in the hospital. We want to help your patients live safely in the comfort of their own homes. If you have questions or need more information about home health care services, please visit our website or call 800-862-2166.